we started out in 2008 in a discussion among various stakeholders, and what was clear is that at that point, the housing rights advocates and the clinic CEO and the promotoras, the community health promoter agency, and a few others were sitting at the table, and everybody was saying very similar things, but the language was very much parochial, right? So, what was interesting was that this coalition that's been working together for a while was still having a problem in terms of finding a common language. And so, long story short, it became clear that what might be an effective mechanism for us to just work better together was the framework and the language specifically of human rights and health. So it caught fire. It caught fire for us in terms of just facilitating the dialogue and realizing the commonality of being able to use similar language, diving in and thinking a bit more about the international experience with the Human Right to Health framework was instructive. And it wasn't so that we were learning something new in terms of the work. The work had always been going on, but the human rights framework was a vocabulary that allowed us to just engage ourselves, rejuvenate ourselves actually in some ways, because it automatically meant that we were in discourse, whether we were reading about it or actually starting to reach out to people outside of the U.S. It grounded us in a feeling that we were part of something a bit bigger, and that's a benefit that I want to underscore, because the feeling of isolation when you're an activist or an advocate for anything is probably the biggest challenge, I think, that certainly some of the folks that I was working with were feeling, and the ability just to link arms, even by use of similar vocabulary, was a powerful one.
Like Rishi was saying, when you use human rights values to frame the issues you're talking about, it gives you a lot of opportunities. There's some challenges there too, but it gives you a lot of opportunities to recenter communities that have been marginalized in debates. It gives you a shared language across issue areas because of the universality of these values and because of the interdependence that all these rights have with each other. You're able to move smoothly and move people from one issue to another issue. So people that are affected by our failed healthcare system, we can move them into LGBT rights work in a much easier way because we're using shared language. We're using the same framework and we're using the same language.
The language you can reach people at and understand. And it rises above, it's about caring for your neighbor, it's about a moral imperative, and that really brought people together.
Now, NESRI is an organization that works also for the right to education, the right to housing, and the right to work with dignity, all issues very, very important for leading a healthy life. So in that sense, we do see us addressing the overarching issues around the right to health more broadly, in addition to the right to health care. The reason we got involved in health care so heavily about 2-3 years ago is really because of the federal health reform debate, because that seemed to be the opportunity to come in and to use the human rights framework to shift the discourse, to change policy, and to act as a catalyst for some local and state-based actions. And we know we're all going to need healthcare at some point. It's not some kind of risk that we need to insure against that may or may not in some distant future happen, that we need a doctor. We all need a doctor at some point. It's just we have different needs at different points in our lives, and some people may need it more than others. But that doesn't mean that we shouldn't all put into the same pool and treat healthcare as a public good that belongs to us all, that is available on an equal basis to all of us, and that shares the cost and benefits equitably. That is not what has happened in this health reform. Indeed, the health reform encourages the increasing commercialization of healthcare through entrenching the insurance industry, giving them more and more public subsidies. We want to make the notion of healthcare as a human right strong enough to be able to use as a tool to counter that, to define healthcare. If it is a right for all of us, it needs to be a public good for all of us, because that's the only way we can share a right on a universal, equitable, and accountable basis. And this is what we've been trying to support in campaigns across the country. And we feel like we have some best practice to share here concerning local and state-based actions. And we're looking to spread the word and then to learn from each other and to build on that movement.
In June of 2009, we had this Health and Human Rights Conference. About 800 and so folks came to this conference. So we had 10 work groups organized around different themes that were related to health, but we're not just limited to healthcare, because it was clear that we wanted to use the conference and the Human Right to the Health framework to do the same thing for the community that it did for us, which is to mobilize us and to engage us. The language itself was the tool that we used to bring people together. And the goal for that day was one day, a really ambitious agenda, and the goal was to have the work groups discuss some of the common challenges, but do it in a discussion around the violence, talk about the problems that we're all experiencing in South Los Angeles, but not just as problems that we all know about, but how are they specifically either barriers to the realization of human rights, or just more bluntly, how are they violations of human rights? And we, as part of that answering of that question, it was clear that we had to educate, right? So it wasn't just saying, here, listen to what human rights are all about. It's just saying, let's answer these questions, and through that process we'll learn about what human rights are. And the second task for that day was to start to draft the South Los Angeles Declaration of Health and Human Rights. From that June until December of 2009, we kicked off a series of community work groups that the conference kind of was a flashpoint for, and all these work groups that convened that in June kept on convening, and all in all about 2,000 residents and leaders and workers came together and helped to vet and draft and toss out and include different elements that they thought would serve as the Declaration of Health and Human Rights. So after at the unveiling itself and thereafter, now it's online. We've had signatories now. Anybody is welcome to sign it as long as they're willing to commit, as the last paragraph there states, as long as they're willing to commit to to all the aspects of human rights, and it's not just about healthcare. This isn't the way I think we envision it. Is that this is an opportunity? This is the entry point. You can come into this discussion about human rights and health from the food security perspective, or from the immigrant rights perspective, or whatever perspective you have, or just as a patient, as a consumer, as people put it, of healthcare services. One of the things that just happened recently was that we were able to host the United Nations Special Rapporteur on the Right to Health. On the first day, he came in on a Wednesday night, hit the ground running on Thursday, getting a tour of all the healthcare services and in South Los Angeles, and then we the next day had a very large town hall event that with the People's Hearing, patients kind of testifying about the violations of human rights, and then he responded, and it was the goal that we had was to make him aware and to the extent that he could be an echo, right? So that he was well informed and had the data he needed, so that he could then convey the message outside. And it wasn't just that it was, obviously it was around South Los Angeles, but we were very clear in saying this is just one among many examples, as you know. And so he did speak, and I think the trip itself was effective, as he put it, for the first time in really diving down deep into the healthcare dimensions of it. Anyway, he did mention the complaints mechanism, so I think it's something that perhaps we can jointly think about how to, or at least how to maybe serve multiple complaints in different areas. It'd be interesting to think about complaints coming from all the communities here and elsewhere, coming in at different times, and the power of 15 complaints coming in and having the U.S. office in Geneva having to respond to all of these things. They hate it, right? And that's all. That's all the more reason we should probably do it.
We should do it.
Right. So there's the complaints mechanism. The fact that he obviously has, as in that title, has the ability to write op-eds and get out in the public sphere, even if it's not an official report. I think we could think about ways we could work with him, and he committed to being open to writing and either talking about some of the issues he came across in the U.S. Or co-authoring certain things if we need to. And I think the other, he has these thematic reports that I think that looking to incorporate the U.S. Right to health, and not just in terms of violations, but also examples of what has been happening as part of those reports and presentations in the near future to the UN would be a powerful mechanism that you spoke about a little bit too.
First time that we jumped into healthcare and the human right to healthcare, we did it around a ballot initiative that was statewide. And the way that ballot initiatives work in the state of Montana is you have to gather a certain number of signatures statewide with distribution throughout the state from registered voters to get it on the ballot, and then everybody gets to vote on it who's registered to vote once it qualifies for the ballot. So we were able to gather 13,000 signatures across the state of Montana. Again, we were able to use that issue as an opportunity to get out to communities and do this training on the human right to healthcare, and we analyzed the policy in terms of the human right to healthcare. We used the language, and we educated our volunteers and trained them on how to talk about this program in human rights terms. So when they were talking to people on the street, asking them if they wanted to sign, they weren't just like, kids are uninsured, you can help them by signing it. It was, we have a failed healthcare system because it doesn't recognize our right to healthcare. And this doesn't solve it, but what this does is expand to efficient and existing public programs that'll be universal for children if we get this on the ballot. And we started meeting with the Lewis and Clark County City County Board of Health, which is the county that encompasses the capital of Montana, which is Health. And found a champion on the City County Board of Health that was willing to introduce a resolution affirming that health and healthcare were a human right, and setting out a plan of action to make Lewis and Clark County a universal healthcare zone. So we were able to pass that pretty quickly, and actually Anya and I have been working for now close to 2 years on local government. It is amazing because it's mostly volunteer. You know, it's really good people who want to do the right thing and want to make a difference. But what they did was they appointed a task force that was charged with doing a community needs assessment, and then in a phase 2 portion, developing an action plan with both short-term, very tangible goals that could increase access to healthcare and increase equity in healthcare in Lewis and Clark County, and then long-term goals that would take a lot more steps. So it would take the entity of Lewis and Clark County lobbying the insurance commissioner, lobbying the state legislature. So there are things that are within the Lewis and Clark County, City County Board of Health control, within the county commission's control, and then there are things that are sort of outside of their scope, but that they can lobby for. But we finished the community needs assessment, and it was really effective. In terms of organizing, what we did is held a variety of focus groups, identifying communities that were most affected and disproportionately and negatively affected by our current failed healthcare system, to try to lift them up. We did a lot of education on the human rights framework within those focus groups. Even within the discussion guide, it was embedded with the values and the language that we wanted to use. And what we found was that almost everyone agreed with the basic statement that healthcare was a human right, which was interesting to see. And that was in terms of a focus group where we were really guiding the discussion, and we got a lot of really interesting information from those focus groups, a lot of great ideas about how in a county that's pretty spread out, that doesn't have a lot of resources, they sort of envisioned a system that would meet their needs and work for their neighbors. Also been working at the state level to try to amend the Constitution to explicitly say that there's a right to health care. And we've had, the second phase of our sort of organizing and education in this program was to do education with allies and our allies memberships. And so one of the things that happened was we were able to introduce a bill in the 2009 legislative session, have a really good hearing where 12 ally organizations came in that had never used rights language around healthcare. We were able to bring them in to testify and in support of that amendment. Unfortunately, the fiscal division put a fiscal note on the bill, and all you guys that work in legislative sessions know that a fiscal note can can make it or break it sometimes. Like, no matter what you say, if you get a bad fiscal note, it's not going to move out of committee. And the fiscal note just said billions and billions of dollars. I'm not joking. Billions and billions of dollars. And so the sponsor refused to sign it. But, they didn't do a proper analysis. So because that was the biggest stumbling block, Anya and myself and a couple other folks involved have been working with an economist from Wyoming and an economist from Montana to actually do a cost-benefit analysis of a rights-based approach in Montana. And it's actually come out the way you'd expect. Everyone in this room would expect it to come out, not to cost billions and billions of dollars, but actually to provide quite a bit of cost savings and to make the system more equitable. So the next time we introduce that, we'll have this paper, and that'll be, I think, really useful for bringing more people to the table.
Several years ago, the Vermont history also was very progressive, and I think we're very much ahead of many states in our programs and our public programs for health. And there had been a bill introduced that was called the single-payer bill several years in the past, but a couple of years ago, and was still sitting in the legislature. So we thought if we could push that get taken up again and worked on, then maybe it actually move something to happen. And when we met with the legislators individually and as groups in our communities, and also with the legislative leaders, they said it's not politically possible to take up this legislation. We're not going to do it. The Worker Center itself is made a decision to change. They felt that they had to change the whole conversation. That we had to say that healthcare is a public good. It's not a commodity, and it has to be a human right. And so, in the spring of 2008, they made the decision and launched a campaign. And the first effort was to develop a one-page survey, and we got that survey and went out everywhere. It was used as a tool to begin the conversation with people. And at the same time decided to hold a series of hearings in each region of the state. It was like our town meeting on healthcare. And we actually structured the meeting, and we had people come in and tell their stories, their own personal stories. We had, on the panel, we had members of the community and some of the politicians. They were there to listen, not to speak. We did give them time at the end of the meeting to comment on what they heard. And that was the first year. And then we also held a huge rally. And meanwhile, we also began to develop in every region local leaders, key, because they bring people in their area. And we developed a postcard campaign. And we went opening day of the legislature, and we hand-delivered 5,000 postcards, which is an enormous amount of postcards for, the population. Yeah. And that was so impressive. And then, I think a couple of weeks later, we had this public hearing in the State House, and it was huge. It was just mobbed. People couldn't get in, and it was just impressed everybody so much. As a result, what ended up happening is that the legislature did pass a bill. Its first part of the bill calls for the hiring of a health systems architect to design 3 or more options, and they all have to embody the principles of human rights, and they put that in there. And it also, in the bill, it does say that healthcare is a public good.